Welcome, everybody. Welcome to this webinar, which is part of our series on ethics and COVID-19. My name is Paul Ndebele. I'm going to serve as the moderator for this webinar. And this webinar is being co-sponsored by the Office of Research Excellence here at the George Washington School of Public Health, and also by the Bioethics Interest Group in partnership with our G11 program in partnership with the Kinshasa University School of Public Health, and also with our R25 program, which is aimed at building research ethics capacity in Bamako, Mali, at the University of Science, Techniques and Technologies of Bamako. Welcome to all of you. Our webinar today is actually focusing on vaccine misinformation. This is a very, very timely topic in view of the current situation we are going through as society. And we have got two panelists who have done lots of interesting work in this particular area. So to get us going, I'm going to introduce our first panelist, but let me also encourage that whilst our presenters are giving their talks, you are free to send in some questions through the chat function. After they are done with their brief talks, we'll have a time to discuss all those issues. So feel free to use the chat function. Colleagues, it's a pleasure to introduce to you Dr. Bhadelia, who is the founding director for the Center for Emerging Infectious Diseases Policy and Research, and also is an associate professor, the section of infectious diseases at the Boston University School of Medicine. Dr. Bhadelia is a board-certified infectious diseases physician and an internationally recognized leader in highly communicable and emerging infectious diseases. Over the past decade, she has designed and served as the medical director of the Special Pathogens Unit, a medical unit designed to care for patients with highly communicable diseases, and state-designated Ebola Treatment Center. She has prior and ongoing experience in health system response to pathogens such as N1N1, Zika, COVID-19, and others. And she has served as a subject matter expert to the US CDC and also the Department of Defense and also the World Bank. Over to you, Nahid.
Thank you so much, Paul. Let me see if I can share my PowerPoint here. I wanted to start by just presenting a bit about my background so you can sort of get the context of my comments. First and foremost, I am a frontline healthcare worker. Yes, my specialty is emerging infectious diseases, and I work at the policy level and health systems level in terms of capacity strengthening. But first and foremost, what I do is I'm at the tail end of some of the vaccine misinformation that you're seeing. I'm seeing the impact of this on our communities through impact on my patients as well. And so I think the importance of this topic cannot be underscored enough. I'll just start by saying I have no disclosures. All the images are mine, unless otherwise credited or stated. And if there are images of patients, they are taken with permission of those who are photographed. And really what I wanted to do is pose this idea of vaccine misinformation against a greater canvas of distrust in science, mistrust in public health, and talk specifically about the challenges that surround around that with emerging infectious diseases and why they're unique. And then talk about this, and I think David is going to talk a lot more about disinformation and misinformation, but I wanted to talk about some of the growing trends that are very disturbing within my scope of the lens in emerging infectious diseases that we're seeing. And then last, I wanted to end by giving one of our solutions that we recommended to legislators and others in terms of how we build that trust and overcome, specifically in the setting of infectious diseases emergency, that distress in public health response. So just a little bit about our center. As Paul mentioned, I'm the director of the Center for Emerging Infectious Diseases Policy and Research. Huge part of the work that we do is a transdisciplinary research combined with capacity strengthening partnerships with organizations in East and West Africa that are already working on many of these issues, as well as a public outreach and legislative advocacy component. And so we're working on multiple parts of the same problem with a narrow focus on the fact that there are a growing number of emerging infectious diseases. Every year, a year and a half, we're seeing a new pathogen on the horizon. And 2/3 of these are zoonotic because we're changing the environment around us. And so these challenges that we're facing around trust, vaccine uptake, these might be ongoing issues as more and more pathogens appear on the environment or on the world stage. So this photo, as a frontline healthcare worker, one of sort of the seminal sort of moments of what changed my practice in medicine was I volunteered during the West African Ebola epidemic. In Sierra Leone, worked in Ebola treatment units for about 4 deployments with colleagues who were national healthcare workers, and the knowledge and sort of the experience that we all had taking care of Ebola patients and other emerging infectious diseases that we've known about since 1976, and we don't have a lot of still haven't developed the scientific database and evidence database as much as we'd like around it. There are common themes of that. We wrote this paper, for example, looking at some of these unique challenges, and I'll talk about how they relate to trust. In 2019, well before COVID, but as I speak about this, you'll notice the similarities that underline or underscore both of these issues. So here's the first one. People want to hear what the truth is, right? They want to hear the definitive evidence behind something. The biggest challenge with emerging infectious diseases, particularly novel viruses such as SARS-CoV-2, is that as the progression of the response grows, you get to learn more about the pathogen. The first 100 patients teach you about the next one. And this novelty, this idea that the scientific databases or evidence base is just being built, leads to evolving public health policy. And that leads to just this distrust, because what people find is that their public health authorities seem to be changing their minds. And so this underlying challenge that science is evolving, and hence there's scientific uncertainty. I think that we still have not done a very good job of talking about scientific uncertainty and relaying that idea of an evolving scientific database around emerging pathogens. And as we leave this pandemic, this is going to be one of our big challenges to try to accomplish. The other is, it's difficult because in these types of settings, you don't even have a good sense early on about how big the problem is. If you can think back to the spring of 2020, you don't have many novel pathogens. It takes time to build facile diagnostics and distribute them to where they're supposed to go. And so not knowing the denominator of how many cases, where they are, how big the problem is, can also affect people's assessment of risk, because public health responders can't tell you, public health authorities couldn't tell you, because that knowledge about the level of risk is growing, as our understanding about the way that diseases are transmitted. And the perfect example in COVID-19, of course, was the moment that we learned that the virus could be transmitted asymptomatically, which flipped all the public health recommendations, right? From you don't have to mask to you have to mask, which is sort of the classic dilemma, or what you've seen, both those who are sort of COVID deniers, as well as those who do not sort of follow the science around the vaccine about COVID-19, harken back to that flip in public health response. And what makes it even more difficult is that, that building of scientific knowledge base in these pathogens is inherently challenging, because you're trying to think about what we have to do. We have to balance patient care and research activities. And there's issues of ethics of conducting research in the middle of an outbreak, right? Trying to figure out what drug works, what drug doesn't work. And How do you do that in a way that shows effectiveness of drugs and doesn't cause marginal cost in terms of patient harm and things like that? And the perfect example here was, as we're studying new drugs, people learn about one study that might show benefit, another that doesn't. And so this idea of it, changing knowledge around treatments that may work versus may not work, I think is also sort of inherent to this. The other is, vaccine hesitancy in my world it predates, many people who are in public health know this, that it predates COVID-19. And in 2019, WHO listed vaccine hesitancy as a top 10 threat to global health. In fact, in 2019, at that point, there were 30% more measles cases, a disease or infection that we thought we had achieved population level immunity to. And we had started to see a drop in that immunity as more and more parents opted their kids out of these vaccines. You started seeing clusters both here in the United States as well as in Europe. And in fact, the first death, I believe, from measles, in a bit that occurred around that here in the U.S. as well. And the WHO list said about 1.4 million additional lives could be saved if you could sort of improve the vaccine coverage that's being impacted by vaccine hesitancy and access worldwide. So that's one part. It's an underlying thing. But what's changed, right? I think that there is an inherent Bernard and group in health security talked about this. There is in fast-moving outbreaks, this idea of distrust, misinformation, disinformation has a real impact on the response. You can have increased transmission. You can have this growing, mistrust in public health responses can cause people to delay seeking care and not engage in prevention strategies that can continue that increased transmission. You can also have violence against government response facilities and protests, and you might see obstacles to being able to sort of conduct the kind of both medical care as well as a public health response as we would like. And then you have stigmatization of people who are actually infected. And we've seen that in some of the prior outbreaks as well. Not so much with COVID-19, thankfully, but I'm guessing that as all of this rolls up, we might see incidences of that as well. And what we also find is that in these settings, these public health emergencies, rapid public health emergencies, a lot of times what happens is existing political sentiments or movements are energized and charged to basically be taken advantage of in this moment. So for example, if there's anti-government or anti-foreigner sentiment, that's what gets exaggerated and attached to a public health emergency or an infectious diseases outbreak. Same thing with political movements as well. Here's what's very, and one of the last slides I'll talk about, here's what's particularly, and I hope David will talk about this a little bit as well, particularly alarming to me that we've noticed. One is, this idea of the role of social media during this pandemic, I think cannot be underestimated in the ability of its impact to affect people's perception of risk. At some point, there was a Kaiser Family Fund survey that showed half of Americans couldn't tell if a COVID-19 vaccine myth was actually accurate or not, right? Or they either believed in it or couldn't tell if it was accurate or not. And that's an immense number, and that's an impact of where people are getting their information. The other is that there is, yes, this vaccine hesitancy and misinformation has existed for a while. What you've seen is politicization, and you definitely are seeing, some of the, I think the data is mixed around this, because I think it needs to have a bit more, I think, methodological sort of examination. However, this idea that red counties in the US are much less likely to be vaccinated versus blue counties in the US, right? This idea that along your political spectrum is what decides whether or not entire communities achieve immunity against a new pathogen through vaccine uptake. And then there's the active ongoing threat of state-sponsored disinformation, which was even before this pandemic. There were articles that talked about GRU-sponsored Russian bots that would just, instill confusion, not pro or anti-vaccine, just confusion around vaccines. And what you've seen is evolution of that. AP, for example, had a story in May of this year where there were reports that GRU agents paid social media influencers, in Europe to sort of talk down the efficacy of Pfizer. So they would say, here's 100 euros, post something on Instagram, that make your own story about how, you know, Pfizer does work. And the interesting thing is, right, if you can create methodologies and algorithms to sort of pick up bots and things like that on social media, an organic disinformation campaign like that one is much harder to pick up and combat as well. And then, of course, we talked about the anti-science and anti-vax sentiment that's generally sort of moving. And the difficulty, of course, of that is that when we say trust in science, I'm uncomfortable with that statement. And here's why: because science is a you know, we fiercely compete ideas, and when a consensus is built, that is sort of hypothesis tested in multiple times, right? And so by saying trust in science, you're almost making science another belief, which it's not. And so this idea of how do you balance that with truly malicious agents out there who are trying to prey on a little bit of uncertainty about certain aspects, to just basically say you can't trust the whole operation altogether. So what we think, one of the things that we think might help is actually a lot more for my world, the infectious diseases, emerging infectious diseases community response to these emergencies. You need to have community-based pandemic preparedness. And we submitted our recommendations to the Senate Health Pandemic Preparedness bill that's coming together about the idea that moving forward, here are some benefits to basically having community input to begin with, you know, on building that trust, on building accountability of politicians to actually invest in those principles, and then to participate in research and knowledge generation in itself. And we can start that now. We start that now with working on partnerships around the long tail of recovery coming out of COVID-19, because you don't build trust in the middle of a crisis. You either build it before or you build it at the tail end of the response. So what we recommended was basically working on community organizations' inputs in the state, national, and local sponsored pandemic preparedness plans to require that of federally funded research activities or you know, capacity strengthening activities, as well as building a consortia that would put that voice out there. I think that by doing that, you might increase that resilience and build greater trust. So just ending with this, you know, basic challenges to emerging infectious diseases, that trust, you know, is dependent on knowing what truth is, and truth changes, or knowledge changes. And that fact that we need to understand that what's happening in the larger trend of disinformation and misinformation. And then lastly, that if we want to work to undo all of this damage, we have to start at the local level and build up. Thank you.
Thank you very much, Nahid, for laying the background. You have touched on lots of issues that I think we need to discuss further. You touched on the need for trust in dealing with emerging infectious diseases, but also the fact that misinformation comes through the fact that as we get to learn more about this particular problem that we are dealing with, right? We are trying to fill in some gaps, and then there is room there for misinformation. But you also touched on scientific uncertainty, and I think that's something that we need to explore further to see how we can address that, so that in reality society is aware that this is something that we need to always be aware of. We have also touched on issues around vaccine hesitancy and also mistrust in government responses, and lots of other important factors that we'll touch on. So thank you very much for laying down the foundation for us. I would like to encourage colleagues, you can send your questions and comments through the chat function. So now, following the talk by Nahid, I would like to present our second speaker, who is David Broniatowski, who is an associate professor in the Department of Engineering, Management and Systems Engineering here at the George Washington University. So he is the director of the Decision Making and Systems Architecture Laboratory, and conducts research in decision making under risk group decision making. This research draws upon a wide range of techniques, including formal mathematical modeling, experimental design, and he has been playing around with the social media that Nahid touched on, issues around Facebook and so forth and so forth. So now I hand over to David so that you can talk to us about your views on this interesting topic.
Thank you very much, Paul, and thank you as well, Dr. Bhadelia, for that excellent presentation. Yeah, I do want to dive a little bit more into the role of social media in all of this, especially given that the World Health Organization has declared an infodemic around COVID-19 in particular, and given the theme of this talk around ethics and biomedical ethics, I think one of the key things that we really need to think about here is how do we go about addressing some of the concerns that people have and are expressing online, and how do those translate into public health outcomes. And so I'll just put my slides up here. So yeah, I'm David Broniatowski. I'm faculty here in the Department of Engineering Management and Systems Engineering, also the Associate Director of our Institute for Data, Democracy, and Politics. And so it's especially in that capacity that I want to talk a little bit about misinformation, but also misinterpretation, because that will address how you might think about responding to the ways in which various actors manipulate the vaccine debate online. And so I want to start out by asking this question: how do we make sense of the COVID-19 infodemic and what's been called the infodemic? So the World Health Organization defined an infodemic as an overabundance of information, some accurate and some not, that makes it hard for people to find trustworthy sources and reliable guidance when they need it. And so directly to Dr. Bhadelia's point earlier, if we want to build trust in the information that's out there, well, the problem is perhaps not that there's not enough information. On the contrary, there may be too much information. And so just as an example, what you're seeing over here on the right is just raw counts of the number of posts on Twitter that have some mention of COVID-19. And this is only in the first 2 months of the pandemic. We're looking at essentially March and April 2020. So just on Twitter on its own, we have 100 million posts. On public Facebook pages, 8 million, and in public Facebook groups, roughly 3 million. And we want to compare that to posts about all other health topics. And as we can see, it's pretty comparable. There, maybe on Twitter, a few more posts about all other topics, but there is indeed an overwhelming amount of information here. And so the agenda, what I sort of want to communicate today is that these messages are really coming from multiple actors with multiple different agendas, and that framing this problem that we're facing as combating misinformation may be an insufficient framing, and maybe something that's actually in some way counterproductive. And so I might ask, well, what might be some protective factors against misinformation or against this overwhelming amount of information? And I'll mention GIST as one possible protective factor. I'll start out with just the term misinformation, which from the OED is defined as false or inaccurate information. And so that of course reminds me of this wonderful comic from CEID where somebody says, "Are you coming to bed?" "I can't. This is important." "What?" "Somebody's wrong on the internet." And so I think that really frames in many ways how we think about the problem of misinformation, despite the World Health Organization's framing as an overwhelming amount of information, some of which is true, some of which is not. We really approach this from a knowledge deficit model, right? Which is to say that people don't know enough. We need to fill the gaps in their knowledge, and therefore they will make the right decisions if we do so. But what about this idea of a misinfodemic? That's an overwhelming amount of misinformation. Isn't it true that there are overwhelming amounts of false content about vaccines and COVID vaccines in particular online? Well, we can actually look at some prior work for this, and Dr. Bhadelia mentioned work in particular about foreign actors manipulating the vaccine debate. And actually, I wrote a paper on this back in 2018. The question that we might ask are whether bots and trolls, online amplifiers, spread false content. And we specifically asked whether they were more likely to post about vaccines than the average Twitter user, but also whether they were more likely to be pro or anti-vaccine. And so we drew on a historical archive of a large number of posts and used a number of different techniques to rate the credibility, essentially, of several different Twitter accounts, as well as identifying known lists of bots and trolls. And essentially what we found was that Russian trolls and the most active bots amplified the debate, but they did it on both sides. So if you look at the Russian trolls that were identified by NBC News, for example, only 47% of them were anti-vaccine. That means 53% were pro-vaccine. Similarly, for the most prolific types of bots, 60% were anti-vaccine, but that means 40% were pro-vaccine. And then the Russian trolls identified by the US Congress was similar, roughly about 50-50. So if we look at the sorts of messages that these foreign actors are promoting about vaccines, yes, on the anti-vaccine side, we see all of the typical tropes, things like the vaccine is an attempt by pharmaceutical companies to make money, or natural infection causes better immunity, and even some of the conspiracy theories, don't get vaccines, the Illuminati are behind it, etc. Vaccines cause autism, all of those sort of usual tropes. But if you see what they're saying on the pro-vaccine side, it's actually quite instructive. We see things, for example, like vaccines are a parent's choice of a color of a little coffin, or my freedom ends where another person's begins. The children should be vaccinated if the disease is dangerous for other children, or you can't fix stupidity, let them die from measles. These are not just pro-vaccine messages. These are what we call anti-vaccine messages. Essentially, these are messages that are designed to promote discord and promote anger, promote trolling. And so we might ask the question, well, what do we see now moving forward? So roughly around March 2020, again at the onset of the pandemic, we started tracking the rise in anti-East Asian sentiment around COVID-19 that was breaking out around that time. And one of the first things we started to do was to ask, well, whether this rise in anti-East Asian sentiment may be organic or maybe in some way associated with a disinformation effort. And one of the first things that we started to do was to identify how do these tweets that contain anti-Chinese sentiment in particular, how do they talk about Russia? And one of the first things we found was that, of course, China was associated with things like unpleasantness and panic, but Russia was associated with calm and pleasantness. And it was a statistically significant difference, whereas we did not find differences for other pairs of countries. So that sort of suggests already that there's something kind of weird going on here, and that there may be some sort of opportunistic use of the existing discourse by foreign actors that are seeking to position themselves as the facts on the ground evolve. Now, of course, this is not only foreign anti-vaccine efforts. We also looked at, over a span of roughly 10 years, how anti-vaccine advocates framed their arguments. And one of the key things that we found was in 2019, coincident with the measles outbreak, the same one that Dr. Bhadelia mentioned, we actually saw a massive increase in the framing of vaccination, not around the science, not around facts, whether it's true or false, whether people could or couldn't get hurt, but as a civil liberty. That's this orange line over here, right? So posts in Facebook pages that have a US state in their title, like California for Vaccine Choice, for example, but also just posts in general, saw a large increase in the ways in which people talked about vaccination as an issue of values, an issue of civil liberties and choice and individualism. And in fact, we saw that this really broke out from the other sorts of vaccine discourse roughly around the time of the release of the movie called Vaxxed. So Vaxxed was a movie that was released by a group of anti-vaccine celebrities, one of whom subsequently became quite popular on Facebook. And we see that this coincides with a decrease here in green of the ways in which people talk about vaccination as a safety concern, and a corresponding increase here in orange of the ways that people talk about vaccination as a civil liberty. So what's the bottom line here? The gist of COVID-19 vaccination opposition is building off of what we've seen in the prior anti-vaccination discourse over the past 10 years. And it's increasingly, don't tell me what to do. It's increasingly about values and about civil liberties, and less about strict falsehoods or strict things that can be corrected by factual corrections. To make things a little bit more complicated, a lot of what we see online, and especially at the beginning of the pandemic, as it started to really spread around the world, was not just being spread by some of these anti-vaccine activists. We actually found that pro-vaccine activists also were spreading misinformative items. In particular, the claim that, if you're worried about the coronavirus, you should get a flu shot, because really the coronavirus isn't a problem, or it's a problem in China, not here in the US. This was, of course, before it spread to the US. But, if you're really worried about diseases, you should get a flu shot. Well, this actually started a trend that was then picked up by anti-vaccine activists who started to claim that, well, you know what? COVID's really not any worse than the flu. And that linkage was actually originally made by several pro-vaccine activists, not necessarily people with any public health background, but a sort of online group here. So the other thing I want to point out here is we did a deeper analysis of tweets and Facebook posts about the COVID-19 infodemic. And I apologize, these slides are a little bit busy, but what I want to do is compare the size of this green rectangle over here about COVID-19 to the equivalent rectangle for Health 2020, health tweets in 2019, and then corresponding amounts for vaccines. And what we actually see is that across all three platforms here, Twitter, Facebook pages, and Facebook groups, there's actually more credible content about COVID-19, not less. And then for low credibility content, it's stuff coming from really known misinformation sites, there's actually less of that proportionally about COVID-19 than there is about other health topics and other vaccine topics. Now, of course, that does not mean that we shouldn't be concerned about it. Of course, we should be concerned about it, but we have to understand what this means in context. As it happens, government websites and URLs with intermediate credibility, those that you couldn't really tell, are they misinformation, are they not, those were the most likely to go viral. These things that made it hard to tell the difference between satire, opinion, and fact. Whereas low credibility sources are significantly more likely to contain false facts. About 3/4 of them don't contain false facts. That doesn't mean that they might not in some way promote a false narrative. But the idea that we're looking at a problem of false facts and that we need to engage in factual correction and myth busting, and that will solve our problem, it seems not to be supported by the data. So the implications here is that this is mostly not about a knowledge deficit. And here now I want to very briefly mention a leading theory of medical decision-making called fuzzy trace theory that emphasizes the role in which the way people understand facts in context, the gist or the bottom line meaning of the facts compared to the verbatim or the actual fact taken out of context. The key insight here is that when we're communicating about COVID vaccines or COVID misinformation or COVID in general, we need to be very careful to give the listeners a bottom line meaning such that they don't misinterpret those facts out of context. The insight from the analysis that I just showed you is that we are awash in facts, and most of those, or at least a large amount of those, are coming from highly credible sources. So the issue is not strictly speaking false facts. Rather, it's the ways in which people may be interpreting those facts, and then because of those interpretations, choosing to delay, choosing to hesitate. And so helping people to derive a correct interpretation of the facts is actually one way that we as public health communicators can be quite effective. So I'll skip this slide, excuse me. So the bottom line here is that people are inundated with information, and our role as communicators needs to be to give them insight. The information environment simply cannot be characterized as a simple misinformation versus true information dichotomy. Fact checkers, mythbusters, all of these things are of course important, but they may not be addressing the most viral content. And so it can't be something that only social media platforms, only fact checkers, only public health agencies do on their own. It requires a coordinated effort, and it requires an effort between those platforms, between responsible news providers that can really understand the context underlying where some of these misinformative narratives are coming from, as well as public health officials that can speak to the facts, but also say what those mean in context. As well as finally, of course, government spokespeople that can speak to what it is that the government is doing in order to best address the pandemic as it evolves. So with that, I'm happy to take any questions, and thank you very much for your attention.
Thank you very much, David, for the interesting facts that you just presented here. And certainly your presence on this webinar shows the importance in terms of having people from various disciplines working together to understand these issues and come up with solutions. You are looking at ordinary citizens, you are looking at the involvement of politicians, you are also looking at the involvement of public health workers. So at the end of the day, it's about coming together, the various disciplines and, proposing some solutions. You touched on the issue of misinformation and misinterpretation, right? So it's very, very important to think about that. But also, of course, the issue of overabundance of information. Now that, we all have the abilities to generate information, and we also have the abilities to receive information through the various gadgets that we have in our hands. You also touched on the issue of the agendas of those people who engage in misinformation. But more importantly, too, you touched on the role of foreign players, foreign governments, and what they can actually do in terms of influencing our own landscape here within the US. And now, of course, we know that there are fact checkers and myth busters because of misinformation. So thank you very much for your presentation and also for some of the recommendations that you put forward. So now I'm going to go into some of the questions that have been posed by the participants through our chat function. And the first question, I'll direct it to Dr. Bhadelia. You referred to pseudo-academization of mistruths. How do we confront that as academics?
Yeah, thanks so much for that question, Dr. Taylor. And I kind of didn't have time to go into that, so I'm glad you asked that, because this is sort of an interesting phenomenon and a challenge as an academic, right? So from the West African experience, from subsequent sort of outbreaks that we've had, one of the big thing has been, how do you rapidly build that knowledge base, right? Sort of new pathogens, how do you rapidly share best practices in the middle of an outbreak? And the prior criticisms had always been, look, it takes forever to get data out because everybody wants to publish, because that's how you sort of get promotions and things like that. And so how do you share public health data in a rapid way that's useful? So preprints were one of the solutions, right? The preprint servers, which everybody in academics now knows have become prolific in terms of the amount of literature that's out there. And some of it is very helpful because it does allow early sort of from good research groups that might have comparability. But all of these are, remember, before peer review, before methodological evaluation. And so it requires a sophisticated audience that's able to sort of make their own assessments. However, what's happened is that preprint servers, which have been great to share information, have also become a breeding ground for just bad science, which, just flooding of potentially non-malicious, poorly done studies that may confuse the matter, but also actually this idea of introducing conspiracy-like, thoughts or discredited, theories into academic sphere to make it at least look academic, so that the regular consumer may not be able to tell the difference. And one example was, so this is not on the actual credibility of this question of a lab leak or whatever else, right? But you guys understand the conspiracy. There's a lot of political angst around this idea of the origins of SARS-CoV-2, which is on the national security groups say that most likely it's from natural origins, but there's not as much data in terms of whether you can rule out an accidental leak from the lab. However, there was a woman, it was a scientist, I think she was a Chinese scientist, who suggested that she knew what, that there was changes in the sequences that implied that this was definitely man-made. And the paper could not be published anywhere. And so Steve Bannon's foundation actually funded her writing up that paper and uploading it on a preprint server that's supported by his foundation called Zenodo, which allowed it to be sort of in its published academic literature, which was then recycled in Fox News as like, look, the studies now show, you know. And so this idea of recycling of conspiracy theories of bad science with the malintent, particularly by political actors, is something that I think it was so effective that I cannot see how this won't grow as a phenomenon. And it's very disturbing to me, you know, as in this field, because I don't know if servers are gonna go anywhere. I think they need to be relooked at. But this idea that you can present data in a way that looks academic and then they will be amplified by, you know, groups for their purpose is kind of interesting. I do want to say one thing though. I think it's hilarious that I quoted David's study to him about the Russian bots, because clearly I'd read it before, and that was exactly what I was referring to. In fact, was his study on the Russian bots on vaccines. So it's just confusion. But two, I do have a question to you, David, about, you talked about this idea that it's about putting context, right? And yes, there's a lot of information, but it's about putting things in context. Here's what's difficult as a person who's on front lines a lot of times doing this, and both as a physician, but also doing it in science communication. There, you know the term sea lioning, this idea on internet of like, you just present the data, you try to put insight, but just somebody tries to get you into an argument, and to the point where like you just get exhausted, and it happens 100 times a day in most settings in the middle of a pandemic. So there's a concerted effort in some ways to almost exhaust public health engagement, right? In this way, so when you try to provide that insight, so it's not simply, there is a huge proportion of people who are looking for insight on data, but there is definitely feels, as you may have heard, two things. One, actual sort of, you know, the Nature study that showed that, you know, I think it was 25% of the public health folks and physicians who engaged in science communication had received threats, right, or something crazy. And I've gotten threats in the past. It will not surprise you, but there is very much a political element to this and a targeting. So it's not just insights, you know, people that are looking for, but it's actually a targeted ability to try to shut down conversation or to drown out that insight when people try to engage with that.
So it's interesting, you actually highlight how the academics actually being used in this particular, in the various examples that you have actually given. And perhaps, David, you might also try and address that question of what we can do as academics in terms of addressing that issue. But there is also a question that is directed to you, which is, how did the shift from science to values help the anti-vaxxers? Was this an incidental or strategic move?
Yeah, so thank you very much for both of those questions, and absolutely, it's a wonderful point. You know, I certainly don't mean to suggest that you know, providing sort of scientific facts without understanding the underlying, you know, political and politicization is all we need to do. I certainly don't mean to suggest that, but I actually think these two questions dovetail rather nicely. The first thing to realize is that there's a relatively small number of highly motivated actual anti-vaccine activists, and that those people, or rather I would say those organizations rather than people, are motivated to spread disinformation because of either geopolitical or profit motives, or you know, in some cases there are of course true believers, but there are organizational elements that drive their behaviors, and I think it's important for us to distinguish between what are sort of colloquially called anti-vaxxers, right? These organizations on one hand, and on the other hand, vaccine hesitant people, individuals. And the way I think about it is that the vaccine hesitant people are a vulnerable population that are prone to being manipulated by the anti-vaccine organizations. And in that situation, you know, those vaccine hesitant individuals, if you find yourself in a situation where you can have a conversation with them and, you know, providing the insight that they may be looking for, that could be effective. Now, of course, if you find yourself in a situation where you're talking to somebody who's vaccine hesitant, and then an anti-vaccine organization or somebody representing one of those organizations comes in and starts trying to troll you, then everything that we know about, you know, online toxicity starts to take hold. And you know, in a situation like that, yes, you are absolutely, as you point out, you are likely to be you know, in an environment where the people who are trying to create that toxic environment, they don't have the same goals, right? Their goals are not to have a conversation. Their goals are to shut down the conversation. And they explicitly target experts. They explicitly target scientists with the specific aim of supporting their organizations, for example, profit motives or geopolitical motives. And so, yeah, absolutely, you're absolutely right that we need to keep that in mind. Now, that being said, not every online conversation about vaccines is going to be infiltrated by anti-vaxxers. And so one of the things that I would argue that social media platforms can do to you know, sort of improve the discourse here is to help people to figure out when are they facing a situation where they're talking to somebody that perhaps has a history of not being transparent about their identity, or alternatively, when they simply have no history at all. It's an account that popped up yesterday, and you know, all of a sudden they're just interested in talking about vaccines. Now, of course, this becomes an arms race. This becomes a scenario where you know, the social media platforms and the bad actors each develop technologies and techniques that combat one another. But there needs to be a concerted investment in order to combat this sort of behavior. At the same time, that doesn't mean we should sort of give up on communicating to people, because we're in a scenario right now where, unfortunately, a lot of these anti-vaccine organizations are very effective in communicating what they believe the insight should be. And we as health communicators are trained to communicate the facts, the science, and simply speaking, a lot of people will not understand the context. So so that takes us now from this question of shift from science to values. I think what we've seen is that there have been, you know, roughly 10 years of practice that these anti-vaccine organizations have developed. And why is it that they're talking more about values? Well, first of all, I would argue that on the scientific level, they've not been able to win. And one reason for that is that if you actually look at the discourse, it started out with things like the claim that vaccines cause autism, but that turned into the claim that vaccines cause SIDS, which turned into the claim that vaccines cause multiple sclerosis, and, you know, one disease after another. So the story keeps on changing, and people that have some degree of cognitive reflection will notice that and be like, wait a minute, this doesn't add up. These aren't the same thing, right? And then they'll say, no, well, it's some kind of brain damage. We don't really know what it is, right? And again, like if you have a scientific mind, if you're trained to think a certain way, that's not going to add up. But if you are, you know, if you are, you know, the sort of person that perhaps doesn't have that sort of training, or even if you have the sort of training, but you find that sort of situation plausible, you might say, yeah, that makes sense, not knowing that it does make sense, right? And so this is one of these scenarios where, by moving away from the science and moving into a debate about values, that actually increases the size of the audience. Because essentially what you're doing there is you're saying, well, you know what? It's your choice. It's your choice as to whether or not you want to get vaccinated. And everyone's like, yeah, I agree with that. I think freedom of choice is a good thing, right? And what that does is that creates a willing audience where, once people have subscribed to the idea that it's a question of choice, or it's a question of autonomy, or whatever the value happens to be, then you have a captive audience and you can throw different things at them and see what sticks, right? And so I would say, yes, absolutely, it's a strategic move. And I think that is supported by the data, where we see that the amount of content about civil liberties spiked with the release of Vaxxed, you know, a media sensation, right? You know, a movie that was explicitly designed to increase anti-vaccine sentiment. And so, yeah, absolutely, I think it's strategic. And I think it's strategic based on essentially, 7 prior years to that movie of message testing and seeing what stuck.
And I think the same is true, actually, not just for vaccines, but other sort of anti-public health movements. One example is this whole the anti-mask debate. A huge part of this is like, again, going back to this values conversation, sort of appeals to this value of anti-government, mask is a muzzle symbolism that's sort of tested in multiple ways and then just stuck because it was, it's a mask mandate. It's something the government is making you do, and so it's much more effective to put it out there as a well, do you really believe on the government treading on you or mandating, putting a muzzle on? That appealed a lot more as a value than potentially just talking about the effectiveness of the vaccine.
Yeah, absolutely, and we found evidence that we've published of artificial amplification of anti-mask sentiment. So, for example, roughly a year ago, is a study that was that came out that did a randomized control trial of the efficacy of masking. Now, there are a lot of problems with taking the results of that study and generalizing to a population level. Primarily, one is that it was a null result, and a null result, you can't say anything one way or another, right? But people misinterpreted the results of that study to suggest that masks don't work. Now, were they wearing masks appropriately? Were they all actually wearing masks? It's other questions, right? But as soon as that study was released, we actually observed on Facebook a massive coordinated campaign of several political groups, including those supporting politicians such as Jair Bolsonaro, the Yellow Vest movements all throughout Europe, and several right-wing organizations, really worldwide, all of which took this study and just blasted it out along these coordinated networks. And again, the key, what do these things all have in common? They draw power, they draw constituency from people that want to oppose traditional elites. And so these organizations were not public health organizations. They were simply using this particular public health issue, wearing masks, to express that distrust of the establishment. And so it really underlines the previous point that Dr. Bhadelia was making about the role of not only political movements, but the role of public health within this broader context. We're not just dealing with public health issues when we talk about public health issues. We're dealing with societal issues, and people perceive those issues through that lens.
Thank you. And Nahid, you touched on the issue of scientific uncertainty. When we're dealing with a problem such as COVID-19, right? In the early phases, we've got limited information, and we are trying, right? We are groping in the darkness. Have we done enough to educate society about scientific uncertainty? What can we do to ensure that society is indeed aware of this issue?
Yeah, I actually, so no, the answer is no, we have not done enough. And then partly because, and I can sort of wax poetic about how part of this just goes to the fact that our public education and, science education is we haven't invested as much as we should in general in those topics. And I think that's where it starts, right? It's better sort of scientific education at younger levels. So a couple of things. So one is, I think, the way that information is presented. And so this is not any study. This is just my personal experience, right? Because you've seen me present scientific data on media. Here's what's so difficult. It's very difficult to talk about scientific uncertainty and scientific methodology in a study and the caveats in a 3-minute spot on national television. And so it has to be the change in methodology of the way we present information to the general public. And to David's last slide about this idea of a collaboration or collaborative action between public health, between politicians, between responsible media folks, I think this has to be one of the ways that media sort of evolves in the way that we present the data. And it's really difficult because the news is about the news. They want to present something that's gonna get eyeballs, catch people to stay there, and a infectious diseases physician going on and on and on about scientific uncertainty in a study probably doesn't capture the same kind of audience, right? But that is actually what we need, and we need sort of a better collaborations between public health authorities, public health experts, as well as media to sort of figure out how to present data that there is a certain amount of uncertainty. Boosters is a perfect example of that right now. How do we speak about the evolving data around boosters? And introduce all the fact that, like, look, people are not out here because they have a motivation. They're looking at data differently, and hence they all have different opinions on, like, you know, how we should proceed versus not. It's all in good faith. It's just different interpretations, and consensus is being built. So that's one. Two is actually we need, and we're looking at this, we just funded, one of the things that my center did this year is actually fund a project by a couple of our public health and communications folks, the BU EpiCorps, on rapid public health literacy, methodology and rapid public health literacy, and learning from the lessons of COVID. So, you know, there's pandemic communications handbooks out there. CDC's written one, you know, like a long time ago before all this. This is not new. But these are new challenges, the way the information is presented, where the opportunities are to make contact with the public. And I think that we need to relook at how that public health literacy on basic scientific concepts need to occur. Scientific uncertainty is one of them. The other is just scientific design and hypothesis testing, right? The perfect example is just because Joe Rogan took ivermectin and survived doesn't mean ivermectin works. And why does it not mean ivermectin works? The idea that you'd need, like, you know, tons of Joe Rogans on both sides with placebo to be able to prove whether or not it works or not. And so I think things like that, of how you sort of do rapid communications and emergencies, would be the other things that we could build better on.
Thank you so much. I can see there are several questions here addressing the issue of disinformation and misinformation, but unfortunately we have now run out of time. So I'm now going to give each of you about 45 seconds for your parting shots. I'll start off with David.
Okay, well, so first of all, thank you very much again for having me. This has been a wonderful discussion. You know, I think one of the key things that we really sort of need to take away from this is the role of scientific uncertainty, but specifically the role of the ways in which that scientific uncertainty becomes mobilized. And that's to say that we have these actors that are out there, and those actors have very explicit agendas, and they draw on that scientific uncertainty. And the scientific method, of course, does not allow us to say what is true. It is a method that allows for, you know, disconfirmation, but that's something that actually gets used and manipulated by foreign actors because people have a need for answers. And of course, people have a need for answers. They need to know what to do. We as public health communicators, when we are facing a situation in which scientific uncertainty is rampant, you know, yes, we can emphasize the uncertainty, but we can also emphasize what we know based on prior studies. Not everything has to be an immediate result of an immediate clinical trial right now. We can say, for example, well, we know that this is a coronavirus. Here's what's worked for other coronaviruses. Here's what we know. It's going to evolve as we learn more, but that doesn't mean we know nothing. And I think that that's the key thing here, is differentiating between uncertainty as knowing nothing, which is to say sort of a nil knowledge, versus, well, we actually know a lot, but we don't know everything, and here's what we know. And I think that that's a really important message to communicate, because once we open the floodgates by saying, well, we know nothing, that's what allows all of these foreign actors, malicious actors, to come in there and say, well, they say they know nothing, but actually we think this is what's going on. And so I think there's a big role here for drawing on the way in which we frame uncertainty, the way in which we communicate insight around uncertainty.
Thank you. And Nahid, 30 seconds.
Yeah, I was going to say, I think I'd echo that. I think that I've actually, I did a TEDx talk in 2016 on Ebola, and I said exactly those words, which was that when we talk about scientific uncertainty, it's a slippery slope where people just assume we know nothing, right? Rather than understanding that there's this big body of literature, and then the uncertainty is this little piece on the top. And so it's really trying to figure out the difference between those two and how we move forward. But I actually am pessimistic. I think this is a growing problem, and I think that we need more resources moving forward. And as you said, Paul, we need multidisciplinary sort of collaborations to be able to solve this, because I don't think we can be in our silos just as public health folks who try to deal with this. I think it needs to come from different sectors.
Thank you very much. I'd like to end by thanking our two panelists, Nahid and David. Thank you for sharing your views with us on this very, very interesting and yet very, very important topic. And thanks to everyone who has attended. Thanks for all those comments and thanks for all those questions. Let's continue discussing those issues. We'll be sending out another invitation for our next webinar. Please look out for that invitation. For now, from George Washington University, goodbye.